Welcome to the Hepatitis A, B, C, D, E Nursing Review. Today, we're diving into the world of viral hepatitis. Starting with the basics, hepatitis implies liver inflammation. Hepat points to the liver, and itis means inflammation. This condition can stem from various causes including drugs, alcohol, and most commonly, viruses. Viral hepatitis comes in 5 main types: A, B, C, D, and E. We'll examine how each type is transmitted, their potential acute or chronic nature, diagnostic methods, treatments, and preventative measures. The liver, a vital organ located under the diaphragm, performs multiple critical functions. It filters blood, produces bile for digestion, regulates blood glucose, and more. It receives blood from 2 main sources, the hepatic artery and the hepatic portal vein. Essential liver functions include bile production to aid fat digestion, playing a role in blood clotting, boosting the immune system, converting ammonia into urea, and breaking down red blood cells. Now, let's detail the modes of transmission and characteristics of each type of hepatitis. Hepatitis A is mainly transmitted through the fecal-oral route, particularly from contaminated food or water. It usually causes an acute infection, meaning it's short-lived without long-term liver damage. Symptoms of hepatitis A, like other types, can include jaundice, gastrointestinal distress, fever, fatigue, dark urine, and joint pain. It can be diagnosed via blood tests for specific antibodies, IgM and IgG. There's no specific treatment for hepatitis A. Management involves rest and supportive care. Prevention includes vaccination, stringent hand hygiene, and using immune globulin in case of exposure. Hepatitis B spreads through blood and bodily fluids. It can cause both acute and chronic infections, potentially leading to severe liver diseases. Transmission routes include sexual contact, for drug use, and from mother to child during birth. Diagnosis involves detecting surface antigens and antibodies in the blood. Treatment might involve antiviral drugs or interferon. Preventive measures include vaccination and use of hepatitis B immune globulin post-exposure. Hepatitis C is also spread through blood and bodily fluids, primarily via drug use. It often leads to chronic infections, with a high risk of progressing to severe liver conditions. Diagnosis is through antibody detection. Treatment includes direct-acting antivirals. Unfortunately, there's no vaccine available for hepatitis C, so prevention focuses on infection control practices like careful handling of sharps and rigorous screening of blood and organ donations. Hepatitis D can only infect individuals already infected with hepatitis B. It shares similar transmission routes with hepatitis B and can also lead to both acute and chronic forms. The presence of specific antigens and antibodies confirms its diagnosis. Treatment might include antivirals or interferon. Preventive measures hinge on controlling hepatitis B transmission. Hepatitis E, like A, is primarily transmitted through the fecal-oral route, especially in contaminated water. It generally results in acute infections and is more severe in pregnant women. Diagnosis involves detecting specific antibodies. There's no specific treatment, but like hepatitis A, supportive care is crucial. While there's no vaccine available in the US, preventive steps include safe drinking practices and thorough cooking of meat. Quick recap of hepatitis types. Hepatitis A and E, primarily fecal-oral transmission, acute infections, supportive care. Hepatitis B, C, D, transmitted through blood-body fluids, can be acute or chronic, treated with antivirals or interferon. When educating patients, emphasize the importance of hand washing, dietary adjustments, personal hygiene, and avoiding liver-toxic substances. Rest is crucial for recovery. Understanding the phases of viral hepatitis is important for management. These include the pre-icteric, symptoms onset, icteric, jaundice and related symptoms, and post-icteric phases, recovery. Lastly, familiarize yourself with key lab markers like liver enzymes, bilirubin, and ammonia levels to track liver health and response to treatment. Thanks for watching and subscribe to my channel for nursing school educational videos.